A mommy makeover is a combination of surgeries to establish the body to its pre-baby shape, sometimes even better. A mommy makeover typically consists of a breast procedure, and then the abdomen is addressed. Extra skin is removed. The hips can be enhanced or reduced as needed. An area that we call the flanks, which is kind of the side. Moms call it the muffin top. That all can be removed, corrected. It's pretty exciting. There's a lot of things that I can do for you. A good candidate for a mommy makeover will be that patient who has all of the signs of having had a baby. The length of a mommy makeover is dictated by the number of procedures that we're doing. It can go from as short as a 2-hour procedure to maybe a 5 or 6 hour procedure. The expected downtime after a mommy makeover will typically vary according to what we do. I have a hotel where patients will stay often when I combine bigger procedures. It's just to cover that first day of convalescence. By day 2, discomfort is lower, they understand their pain meds, they're up and walking around, and then they achieve normalcy over the ensuing 2 or 3 weeks. The unique thing about mommy makeover is that you can see the difference practically instantly. There still is a period of convalescence where the scars need to lighten, swelling needs to subside, and that takes time. Something that patients will tell me before a mommy makeover is, I don't wear a bikini. And I tell them, you might. And it is super common to see their post-op photos. We won't even have a conversation about it, and I'll see the tan lines on their post-op photos. And quietly, I'll see it on my computer, and I'll kind of think, I told you so. I would say to a young mom who's considering a mommy makeover that it's worth it. I've helped so many moms through that procedure. I don't know that there is a mom that exists that wishes they hadn't done their mommy makeover with me.